Hi everyone. Hi, my name is Shweta and I'm the founder of Ayush for Life, Ayurvedic Holistic Wellness Center here in Kitchener-Waterloo area, Canada. And today, yet in another episode of On Women series, we are going to talk about painful periods with Dr. Kajal, all the way from India. She's an homeopathic expert and has been in the industry for quite some time and been supporting so many women patients having this problem. In our last week, we talked about painful periods, dysmenorrhea from an Ayurvedic perspective, and today we are going to talk about from a homeopathic perspective. She's a homeopathic expert. So let's call Dr. Kajal from India, and she's going to talk about the painful periods. What is it? What are the other symptoms that we can talk about? Um, is it really normal? Is the painful periods, is the pain in the periods normal? And what homeopathic support can provide to the patient, to so many women who are having painful periods. So let's invite Dr. Kajal, and please bear with me. She's going to be here with us. The invitation has been sent. She's going to join us in a minute or so. Till then, if you have any questions regarding painful periods from Ayurvedic perspective, please happy to answer any of your queries, happy to support. Last week I mentioned about how important it is to have an intake of ghee in your diet. So diet plays a very important role when it comes to okay, Dr. Kajal has joined us. Hello, Dr. Kajal. Hello, Dr. Kajal. So
Hello,
happy
good
to
evening, India.
invite you on our platform. Over to you.
Thank you so much, Dr. Shweta.
So I was telling our viewers, if you can mute your mic, please. Thank you. Yeah. So I was just telling our viewers that there's some kind of problem on our connection. So we are going to mute and unmute in between our conversation. And today we are going to talk about painful periods, a very common problem among fertile women. And so many women, especially from all over the spectrum, they of their lives, they come and come to us, on from a practitioner perspective. We need to really drill down into their history as to why they're having those periods. And diet plays a very important part when it comes to Ayurveda. So our viewers are quite curious what happens, how homeopathy can support, since Ayurveda, homeopathy, Unani, yoga, all these are holistic, medicines that can really amp up the quality of life for any patient who are looking for holistic therapies, who are exploring them. So you being an homeopathic expert, and you have supported so many patients in your clinical practice, please provide your expert insights when it comes to painful periods. So my number one query, that patients to come often, they ask, like, is that pain normal? Because it has been normalized in the society so much. So can you talk a little bit more about whether it's normal, it's abnormal, it's not, pain is a strict no? What does that mean from your perspective?
Okay, am I audible? Okay, that's great. So, yes, this is a very frequently asked question, Dr. Shweta. And as you might also experience this in your practice, that almost on everyday basis, we get women who are complaining of this thing. So, by that, we understand that how common is this problem, right? Now, when we talk about whether it is normal or it is not normal, let us first understand that why does this happen, and then we come whether it's normal or not. So our as we all know that the female reproductive system consists of various organs, one of which is the uterus. It is the womb where the baby grows, right? Now, when this uterus, when it sheds its lining, that is when you get the periods or the bleeding that we call, or the periods, menstrual cycle. It has various names, they all mean the same. Now, what happens is this uterus contracts, it sheds its inner lining, which is called as periods, which may have the bleeding along with some minimal clots, and there can be pain related to that. Now, why does this happen? Is because there is a hormone called as prostaglandin, which is involved in this process. Now, if there is abnormal high level of this hormone prostaglandin, so that will cause more severe pain and more severe cramps. So by this we understand that pain is not normal, because if the level of hormones are within the normal limits, ideally a woman should not experience pain. A woman will experience pain only when the level is beyond normal. That means that the levels are high. So yes, dear ladies, if you get pain during periods, firstly understand that it is not normal. Secondly, to understand whether it is something grave or not, or whether it is something curable or not. So it is very much curable. We can easily treat it. Okay. And as far as homeopathy is concerned in this matter of subject of painful periods, I would like to share today on this platform that homeopathy has an excellent scope for painful periods. Now, why do I say that? Day in and out, we are seeing women with this complaint, and as women are now more into work along with their personal life or domestic life, this has created a havoc in their hormonal levels. Their hormones are going for toss. That is one of the reasons, again, why we are seeing increase in number of PCOS cases, PCOD cases, problems related to conceiving. The conceiving part that I'm talking about is more of the functional part right now, because I'm talking about hormonal imbalance. Of course, there can be some other structural reasons as well to that, but these are the common reasons, the primary infertility that we talk about. So balancing these hormones are extremely important, not only for a woman to have good periods or easy periods, but for an overall well functioning of her body. A lot of things in a woman's body is related to hormones, whether we talk about thyroid hormones, reproductive hormones, and whatnot. They are all interrelated and interdependent. When any of these go haywire, it may or may not have an effect on the other hormones as well. So, having said this, now what can we as homeopaths do for balancing these hormones? Firstly, we take an entire detailed history. I'm sure all of you all must have experienced this, that whenever you all have visited a homeopathic doctor, you must be wondering why do they ask so many questions, or why does the process of case taking, which we call, takes so longer as compared to any other doctor that you visit. So this is because there are various factors that play role when you fall sick. These factors can be at multiple levels. It can be something related to your mind, something related to your body, how your social life is creating an impact on you, what are the stress factors in your work life, in your personal life, or what are the interperson relationships, and what is the ratio of that relationship in your life. Is there any strain in some relationship which is bothering you? Because why all this is important? Because all these can have a direct effect on your hormones. When we talk about hormones, it's a very complex mechanisms. Our hormones are released from the pituitary gland, which is situated in our brain. Now, there is no fixed, I mean, of course, there is a fixed amount of release of these hormones, which again depends on various factors. But because of our life that we live, whether we talk about the mental factors, the interperson relationships, the stress, the various kind of stress that is available, that definitely hampers the release of these hormones. So that is why a homeopathic doctor talks in depth about what are the stress that you're going through, or what is your mood in general. A lot of time you will see that the women who experience painful periods may also suffer from other complaints related to periods. Like, they may have irregular periods, or they may just suddenly skip dates. They may have even pain in the back, pain in the thigh, or they can have breast tenderness, they can be extremely irritable, there are mood swings, or on the physical side, they can have migraine, they can have constipation, diarrhea, this, that. So, what I mean by enumerating these symptoms is they can suffer from any symptom. Now, every woman who will experience these symptoms, that is particular or dependent on that woman, depending upon what stress she's facing and depending upon her coping mechanisms. I'm sure we all understand that we have different level of thresholds and coping mechanism to deal with stress in our life, right? Something which is very stressful for me may not be as stressful for Dr. Shweta, and that goes for everybody, right? How I cope up with things may not be the same way like how you do. So that is also something which plays a very important role. That's why when the patient comes to us in homeopathy, we take all of these details. We talk about the food that you eat, the timings that you have, your pattern of elimination of urine, stool, your sleep pattern, your dreams, everything. So you might be wondering that I don't have any complaints related to these things. So why are these questions asked? But yes, these questions are asked because all of them have a direct or indirect role to play to make you sick. So, in order to find out why you are sick, we ask these questions. Now, if we talk about homeopathy, like for any particular complaint, let's talk about painful periods, which is our today's topic. So, there are more than 100 medicines for just this complaint. Now, how do I decide that which suits you the best? So in order to decide that, I need to know why are you suffering? What is the cause for your suffering? Whether the cause is some stress. So if it is stress, where is the stress from? Is it work life? Is it private life? Is it because of some drift in the family relations or having some, you're unable to cope up your daily balance, your daily routine? What is it? So having found out that, we find the best medicine for you. So that is one of the reason why we take so much of details in homeopathy, and then a particular medicine is prescribed to the patient which works the best for them. So our medicine is not only to relieve the pain for this current period, but there are medicines which would help you to set the hormonal balance in a correct way, which is the root cause of the pain, right? So just superficially treating your pain with some kind of painkillers is not really a solution. Yes, temporarily you might be happy that okay, I'm pain free, I can go to work, I can cook food, but in the next cycle you're again going to get the pain. So in order to find out that what exactly is the, the permanent solution for that, so permanent solution is only to balance those hormones, and that is what homeopathy will do in a long term. So not only will it help you to get rid of pain, but even the future cycles, it will help you to normalize those cycles. Ideally a normal woman who is healthy, apparently healthy, does not has any hormonal imbalance, so if she gets periods, she should not have any kind of discomfort, whether on mental level or physical level. And I think this statement is extremely difficult in today's time because we are seeing that they come with variety of complaints, whether it is on the mental aspect or physical aspect. But yes, we need to understand that if you're facing these problems, then definitely you need to work out on hormonal balance. Over to you, Dr. Shweta.
Thank you so much, Dr. Kajal. That was wonderful background that you shared with us, with our viewers. And I completely agree. I'm glad that you brought this up. When it comes to holistic management, you have to not only see the physical aspect or component of the health, but also see, the mental, emotional, psychological, which is actually kind of underestimated. So I'm so glad you brought this up. Now, patient, when they come to us, they fail to understand that we are not only looking at the physical perspective, of the complaints that they are telling us, but what's the behind reason, what's the cause, right? So there are hundred of medications also prescribed in Ayurvedic texts when it comes to painful periods, and we have to control the vata dosha, and that vata dosha needs to be like there are different interventions, Ayurvedic interventions, when we have to balance vata dosha, but what exactly what and we need to find out that why is it happening at the first place. So finding that root cause is the key to your, getting relief with this problem, with this painful period. So I really, really, really wish and request all the patients potential who are, having problems with periods, that when you come and see a holistic practitioner like Dr. Kajal, like myself, have patience to understand why there is period problem at the first place. Maybe it wasn't at first when you started having your menstrual periods. Maybe it started 2 years ago, 3 years ago, 2 months back, 2 weeks back. All right, and what's that main reason behind that pain. So we need to understand that. There's a beautiful quotation in Ayurveda, which actually explicitly says what is swasthya, what is your health. So it is sam dosha, sam agnishcha, sam dhatu malakriya, prasanna atma indriya mana swasth iti abhidhiyate, which means that you have to have like a balanced dosha, balanced agni in the body, balanced dhatu, the tissues elements all are healthy in their spectrum, and balanced way of eliminating all the toxins from the body. And then you have a prasanna atma, which is means that you are internally happy, you are not stressed by your work relationships or family relationships and whatnot. And then you are called swasthya, then you are called swastha. And otherwise you are ill. You know what I mean? If you are physically healthy but you are mentally very stressed out, then also you are not happy, you are not swasth according to Ayurveda. So thank you so much uh, for bringing this up. I wanted to add my points, my perspective, Dr. Kajal. But over to you again. I would say, if you have top three tips for our viewers, especially from a homeopathic perspective, what are these top three tips that you would like to share that can help them at least prevent painful periods? Over to you, Dr. Kajal.
Sure, yes, this is a very important question which needs to be addressed. The first thing that I would like to tell these women is to understand that, as we discussed, that it is not normal. So, having said that, we first make you aware that, okay, you need to see a medical health professional for this concern, right? Because you cannot be having a hormonal imbalance for a prolonged period of time, because that in turn will cause a lot of other issues. So fixing the hormonal imbalance is extremely important. So as soon as you start getting painful periods, which can occur at any age of life, it is not important that a lady should have it right from the beginning, right from puberty or so. It may happen suddenly in your 20s, in your 30s, anytime. So the first thing is to identify the problem and to visit a person who can help you to solve the problem from the root cause. The second thing would be to make yourself aware of, because self awareness is extremely important, because when you visit us as well, whether we talk about in terms of homeopathy or Ayurveda with Dr. Shweta, so first thing would be to be aware of what are your stress concerns, where exactly you feel difficult to cope up with things, whether it is in terms of your family life, in terms of your work life, or if you're worried about your promotion, or you're worried about your finances, what is it? So identifying secondly that what are your stress factors and what is your mental health at that moment is extremely important, because that is how we are going to deal with it at the root cause. Otherwise, just having medicines for pain will not solve the thing at the root level. You may have a pain relief period for that month, but the subsequent months would be painful. So, second thing would be that. Third would be, as we talk in today's world a lot about, feminism and being equal with men, and being able to balance all the aspects, whether it comes to work life, professional life. I would say it is not that women cannot excel in any of these spheres of life. People have done that time and again, and we don't need to prove that we are capable because we know we are. Okay, that's been proved already. So stop trying to prove that. Understand your body. आप उतना ही स्ट्रेस लीजिए जितना आपकी बॉडी आपको सपोर्ट करती है. डू नॉट स्ट्रेन योर बॉडी for a longer period of time. And by your body, I also mean your mind, because mind plays a major role in various diseases, not just painful periods. It's like just one simple and common topic that we are talking about. But in general, when we talk about health, as Dr. Shweta beautifully said, what health is. Similarly, in homeopathy, also when we talk about health, it's not just physically health. Physically, we may all be functioning very well and at our optimal capacity, but the point is, how do you feel mentally? How do you feel socially? All that is also very important. So these are the three things from my end. There's just one thing that I want to add up from my end, Dr. Sweta, and that is when it comes to irregular periods. Do I understand our today's topic is painful periods, but I want to take this opportunity to talk about irregular periods because I see a lot of girls who are just popping in oral contraceptive pills to solve this problem of irregular periods. Now, the problem with this is when you take it for a very long time, it has a lot of short term and long term side effects. Also, we need to understand that these medicines were originally made for contraceptive purposes. Okay, it was much later that they started using it as a tool to regulate your periods. Now, my problem is when you take these pills to regulate your periods, you might be very happy that, okay, ma'am, I'm taking be back at square one. Again, you're going to have irregular periods. Again, you're going to have a lot of other issues. Having said this, please understand that these pills are not providing you solution at the root level. It is not solving your problem of hormonal imbalance. It gives you a very, very temporary relief. So in case if you're even using it, use it for a short period of time and just stop using it. Switch to medicines which give you long lasting effects, which treats you from the root cause, which in this case is hormonal imbalance. And always discuss with your physician that what are the long term side effects of taking these oral contraceptive pills. That's it from my end, Dr. Shweta.
Thank you, Dr. Kajal. That is, gold nuggets that I would, um, I would say you are literally passing on all that information. Thank you so much. We do have some queries coming from our viewers. So they're asking, is there any Ayurvedic, any homeopathic medicine, especially to cater pain during periods? Any homeopathic medicine, and they want you to please use Hindi as a medium to interact. That will be great.
श्योर द रीजन कि हम आज इंग्लिश में ज़्यादा बात कर रहे थे बिकॉज वी हैव ऑडियंसेस ऑल ओवर द ग्लोब. हमें इंडिया से भी व्यूअर्स हैं, हमें कनाडा से भी व्यूअर्स हैं, इसीलिए हमने चूज किया था कि हम इंग्लिश में कॉन्वर्स करेंगे. बट नेवरदलेस हिंदी इज ऑलवेज आवर फेवरेट लैंग्वेज. सो ओके, कमिंग बैक टू आवर व्यूअर्स क्वेश्चन अबाउट अ होम्योपैथिक मेडिसिन. सो जैसा कि मैंने आपको बताया कि होम्योपैथी में इस तरह की कोई स्पेसिफिक मेडिसिन नहीं होती है. 100 से अधिक दवाइयां हैं इस तरह के दर्द के लिए. इस 100 में से कौन सी आपको सबसे ज्यादा सूटेबल होगी वो बताने के लिए मुझे आपके स्ट्रेस फैक्टर्स जानना, आपका जो माइंड है उसे जानने बहुत ही जरूरी है. सो that is the reason, yeah, I cannot give you a specific name of the medicine because that is how homeopathy works. होम्योपैथी बहुत ही कस्टमाइज ट्रीटमेंट देता है आपको, इंडिविजुअलाइज ट्रीटमेंट देता है. एंड आई एम श्योर डॉक्टर श्वेता कैन वाइब with me on that because Ayurveda also works on the same principles, right? तो इस तरह की आप प्लीज स्पेसिफिक मेडिसिन हमसे मत पूछिए बिकॉज इट्स वेरी डिफिकल्ट इस चीज का जवाब देना बिकॉज हम जो ट्रीटमेंट देते हैं वो बहुत ही कस्टमाइज होता है एंड दैट इज द रीजन दैट इट गिव्स यू लॉन्ग लास्टिंग इफेक्ट्स, राइट? जिस तरह का एक साइज का कपड़ा नहीं होता है हम सबके लिए, इट इज वेरियस साइजेस एंड दिस एंड दैट, सिमिलरली इट इज फॉर मेडिसिन. आप वो चीज क्यों सफर कर रहे हैं जब हमें वो पता चलेगा, और जब हम आपके हार्मोनल बैलेंस को सेट करेंगे, that is when you will stop getting periods. So moral of the story, there is no one specific medicine, it all depends आपके ऊपर, आपके mental and physical health के ऊपर depend किया जाएगा.
Thank you, Dr. Kajal. We do have another query from one of our viewers, Mama Veda. So they are saying, do you recommend the use of oils such as clary sage, frankincense, and lavender during your cycle? What do you have to say about these oils? Do you recommend the use of oils during the cycle?
Okay, so in homeopathy, we don't do these kind of things of applying oil locally. होम्योपैथी में हम मुंह से दवाइयाँ देते हैं which are very effective, and I think I'm the wrong person to comment on oils. Maybe Dr. Shweta can answer this question much better than me because we don't use that kind of modality in homeopathy. So over to you, Dr. Shweta, if you would like to add on to this question.
Thank you so much, Mama Veda, for asking that question. So yes, we do use oils, but these are different oils that the names that you have mentioned in your query. We do make our customized oils that are infused with Vathar herbs. So when we talk about painful periods, it is caused due to Vata dosha, and there are many herbs mentioned in Ayurvedic texts that balances or curbs down the excess Vata dosha during these painful periods. So we infuse them and we do use them locally, as well as there is oral intake, as well as there is anal intake too. So, there are panchakarma therapies such as basti treatment that we do give to the patient having dysmenorrhea, and there are, I would say, in my clinical experience, 100% successful rates when it comes to basti treatment, because basti treatment is the best treatment to curb down the excess vata dosha. So it's a vata balancing Ayurvedic therapy that should be done under a supervision of an institutionalized Ayurvedic expert. Yeah, that I hope that answered your questions. There's another one, following up the question that was asked earlier, Dr. Kajal, that is it okay for the other doctors to give all these, pain relieving medications during painful periods? Is that okay or is that not? What's your intake on that? Over to you.
I'm sorry, I didn't get the question. So what type of medicine are you exactly talking about, dear viewer? If you can elaborate it, is it you're talking in terms of homeopathy particularly, or you're asking in general about the over-the-counter medicine? What is it? So maybe I can answer better once I know your question exactly. Any other question meanwhile?
Okay, so Dr. Kajal, if you can mute yourself. So the question is, मैम मैं मेडिकल शॉप पर काम करता हूँ, काफी सारे डॉक्टर बिना मतलब काफी सारी मेडिसिन लिख देते हैं, वो देख हमें बहुत दुख होता है कि क्या क्या कर सकते हैं, क्या सारे डॉक्टर आजकल सिर्फ पैसे की वजह से ऐसा करते हैं? अगर अगर आप अपनी थोड़ी इंसाइट्स बताएं इसके ऊपर, कैसा महसूस करती हैं आप? क्योंकि मुझे लगता है ये हेल्थ केयर सेक्टर में ही काम करते हैं, मोहम्मद जी, और इसलिए इनके ऐसे एक्सपीरियंस रहे हैं और इसलिए ये हमसे ऐसे क्वेश्चन पूछ रहे हैं. Thank you so much, Mama Veda, for your interaction. Happy to provide more information if need be when it comes to Ayurveda. Over to you, Dr. Kajal.
Okay, so as far as the medical prescriptions are concerned, firstly, I would not like to comment anything on that because जो वो डॉक्टर ने लिखा है वो क्यों लिखा है, उस पेशेंट को एग्जैक्टली exactly क्या तकलीफ है, हम इसके बारे में कुछ नहीं जानते. सो जस्ट सिटिंग हियर रिमोटली एंड टॉकिंग अबाउट व्हाट समबडी एल्स डज, I am not that kind of person because I'm not aware of what he is doing and what is his line of thinking. तो जो आपका एक्सपीरियंस रहा है डियर व्यूअर, सो आई वुड रिकमेंड, अगर आप इतने ही क्यूरियस हैं इस सवाल का जवाब जानने के लिए, तो वो प्रिस्क्रिप्शन पे आपके पास डॉक्टर के सारे डिटेल्स हैं, आप एक बार जाइए, आप उनसे मिलिए पर्सनली डॉक्टर से, एंड मे बी दैट डॉक्टर कैन आंसर यू वेल. उन्होंने क्या दवाई दी मैं नहीं जानती, क्यों दी मैं नहीं जानती, सो आई कैन नॉट कमेंट वेदर इट इज राइट, इट इज रॉन्ग और व्हाट इज इट. एवरी डॉक्टर हैज हिज लाइन ऑफ थॉट. आज अगर मेरे पास एक पेशेंट आता है तो वी हैव अ थॉट कि हम ये करेंगे, हम उसके बाद में ये मेडिसिन देंगे. सो देयर इज a channel of thing, a flow chart basically, which we follow, and that is there in all systems of medicine, whether it is allopathy, homeopathy, ayurveda. So it is very unethical and wrong to just raise finger at some other doctor. I'm sure all of the doctors are giving their best day in and day out. Even in spite of the tough times of COVID, they were always there for their patients. So I think एक केमिस्ट होने के नाते, एक मेडिकल शॉप होने के नाते, आप आपकी जो ड्यूटी है आप वो कंप्लीट करिए, वो आप अच्छे से निभाइए. एंड जो प्रिस्क्रिप्शन का काम है वो आप डॉक्टर को छोड़ दीजिए. आई एम श्योर आप दोनों अपने फील्ड में बेस्ट हैं. सो लेट अस ऑल डू व्हाट वी आर इनटू, right? So it will make everybody's work easy and there will not be any confusion. And still, if you have any questions related to prescription, please go back to the same doctor, and I'm sure he can give you a very good justification of what he's doing and why he's doing. That's it from my end.
Thank you, Kajal. I would second with you. I wouldn't have questions about how that doctor is actually diagnosing that patient. I haven't seen the patient. I haven't seen what's going on when it comes to treating any XYZ disease. So I would second with you whatever you mentioned. And thank you so much for your insights. And thank you so much for your time today. Really, really appreciate it. I would be happy to uh, come next week at the same time and talk about yet another, most common problem when it comes to women's health, which is menopause. So, all our viewers, please stay tuned for our next episode. We will be having all these, candid conversations and informal ones when it comes to talking about what is menopause and what Ayurveda, how Ayurveda can support a menopausal women, and what all things can be do at home, what all Ayurvedic remedies that you can do at least at home to help yourself when you start and begin a new journey in your life, when you enter your menopausal or premenopausal, shall I say, that age. So happy to provide my insights. Thank you so much आप सभी के समय के लिए जो हमें लाइव ज्वाइन किया, देखा, क्वेश्चंस पूछे, और आप सभी से अगले हफ्ते इसी टाइम मिलेंगे. धन्यवाद. Thank you so much, Dr. Kajal.
Thank you so much for inviting me, Dr. Shweta. It was a pleasure talking to you as always. Guys, stay tuned with us. Next Friday, we meet at the same time. Keep your questions, if any, ready with us. Thank you. Bye bye.